I learned so much about what's truly driving health outcomes, good and bad. I just really feel like the world needs to know this information because these little nuanced, what's in your kitchen, what's in your clothing, what do you breathe, what do you eat, all the epigenetic inputs are the choice between chronic disease or not.
Hello, everybody. Welcome to another episode of Connors Clinic Live. I'm Dr. Kevin Connors, and we have an interview with Kashif Khan, which is, Kashif, you interviewed me in a summit a number of years ago, and we haven't really spoke much since then, and I feel really bad. And finally, Dustin said, hey, you haven't talked to him for a long time. We need to get him on a podcast. We promised to do that. And I see your Instagram videos. You're all over Instagram. So I follow you on that, and I'm not really on YouTube, but I follow you on Instagram, and I think you're probably on Facebook too. You have a good presence, and you do a lot of really good education. So I'm going to let you talk, but I just want to make one comment real quick.
Sure.
I follow, and I get emails or messages from people or videos sent from people, and even my staff about other quote unquote natural doctors or natural practitioners. I don't know. They're all doctors making comments and making these little videos that so many of them I disagree with. It's like, what? That is totally not true. That's totally wrong information, and it gives natural doctors a bad name when they make these ridiculous claims. I never see that from you. So I have to tell you right off the bat that I respect you for that. You're not saying, hey, put this in mineral oil and put it in your body and it solves all these problems, some stupid thing like that. And so thank you for that. So now let's jump in to talk to you and tell me what you've been digging into lately.
Yeah, thank you for saying that. It speaks to what we do. Where is this all coming from? So I'm online telling the world all this bad news about what makes you sick, and to some degree also how to solve it. And this comes from a space. I'm not a clinician, not a scientist, no formal training. I was sick, 5 chronic conditions. I had eczema to the point where I couldn't open my left eye. It was like literally sealed shut. I had psoriasis. I like literally my knuckles would be bleeding from the cracks and the open wound, and migraines, gut issues, depression. Actually, there was a 6th one. There was also a reflux issue. My gut was just totally disrupted. So anyways, in that journey, I'm in Canada, I'm in Toronto. So we have a government healthcare system. Everything is free, but it's all disease-centric and symptom-centric. So the measure of success was that I was taking 5 different pills from 5 different doctors, maintaining and managing what I had. And I had never been sick prior to that, like never. I didn't know what this was all about. So I asked the question, what did I do wrong? Why? Why all of a sudden 5, 6 multiple problems? I must have eaten something. I must have done something. Just logic kicked in, right? And the answer, if I were to paraphrase, it's like, we don't do that here. Diagnose, prescribe. Here's what it's called. Here's the pill. We've solved the problem. And so that put me into this sort of rabbit hole journey of trying to understand how the body worked, which I never understood prior to. I started to understand biology. I started to dive deep into genetics, and I understood that even that was broken. There was a very disease-centric view of genetics, and it needed to be more functional. And so I made it more functional, and I slowly healed myself. And then I slowly got my arthritic mother out of bed and my anxiety-induced niece back to school, and so on and so on and so on. And the research continued. And what you're now, fast forward several years, I built a business around it where we supply functional testing to clinics. I learned so much about what's truly driving health outcomes, good and bad. That's what I speak about online now. And for me, it's like, if you watch my videos, I'm not selling anything. I just really feel like the world needs to know this information because these little nuanced, what's in your kitchen, what's in your clothing, what do you breathe, what do you eat, all the epigenetic inputs are the choice between chronic disease or not. Yeah. And as complex it is, it's a simple thing to deal with.
Well, and I want to touch on, I think, a major point that you just said. You said you healed yourself,
Hmm.
um, and you had to learn information. And I think, we are still told there's a lot of people that are in that boat that they're learning that they have to take responsibility for their own health.
Yeah.
But it's still a little boat compared to everybody else that's in the
Yes.
cruise ships following the practice of medicine. I don't see the medical doctors getting any less busy. I don't see the hospitals
Yeah.
emptied out. To me, that's a very sad thing, but it's a very it tells you how important marketing is as far as pharmaceutical companies own everything on the television.
Yeah.
Pharmaceutical companies own the doctors. You go to a doctor and they're just paid pharmaceutical reps. That's all they are to
Yeah.
dish out these drugs. And like you said, we don't do that here. We don't even know what you're talking about.
Yeah. The United States is one of two countries in the world where pharmaceutical companies are allowed to advertise. Right?
Yeah,
It's US and it's New Zealand. In New Zealand, it was only because there was some drug that they needed seniors to be aware of. And if you look at the budget, it's like a few $1 million versus the tens of billions that is spent on marketing every year in the United States. And even the United States, that was the original intention, is there needs to be awareness around novel, new drugs that can benefit a certain population that may not know that it's possible, but it turned into a consumer marketing machine
right.
of like, I don't even have a problem, but this sounds good. And
Yeah,
that's kind of where we're at now. And so there's this belief, like you said, I can do whatever I want, eat what I want, breathe what I want, stress levels, sleep levels, whatever, and it's the doctor's job to fix me when I break something. That's
that's
the
right.
belief. And we've completely lost what health is. And the other thing that we've lost around health, because we believe that when something's broken, you fix it, right? And that's like a stamp in time where from sick to not sick, etc. Versus health is something you maintain. Even myself, I know that 2, 3 weeks, as far as I've gotten, considering myself in biohacking territory now, gone far beyond cured, far beyond optimization, far beyond what supplements do I take. Like I truly think of myself as a biohacker. I'm now into anti-aging world, right? Even then, I know if I spend 2, 3 weeks doing the wrong thing, I'm going to get sick again.
Yeah.
So it's knowing that this is a maintenance program. It's not a band-aid by any means.
Well, especially when we're getting inundated with so many poisons on a daily
Yeah.
basis. Even when you're trying to eat organic and do the right things, you cleaned up your house, you got rid of toxins in your household, and it's an endless fight. I mean, we're being sprayed with stuff in the air. We're being, you can't get away from this stuff. Chemicals are just being created in laboratories on a weekly basis, and seeing how we can make money and use these to, quote unquote, better the population, but it's actually poisoning us.
You have 144,000 chemicals added to humanity since the 1970s. Our ancestors had zero exposure to this stuff. Even people with the best genetics can't cope with today because their best genetics were based on an assumption that we're cave people, walking out into beautiful nature and killing a buffalo and plucking a plant out of the ground. And the best defenses are for that context, right? So you have all these chemicals. You have an average woman is putting 500 chemicals a day on her body between her shampoo and her cosmetics and her fragrances. You have 4.5 pounds of chemicals flowing through a female body on an annual basis. You probably saw this study that came out, it was about a couple months ago, about the average American consumes a credit card worth of plastic on a weekly basis.
Yeah,
We're inundated constantly. And so the reality of how we think about our health, it's no longer things are good, and until something's broken, health is not something I think about. Things are not good. You step out of your home, even in your home, you probably have mold, you probably, the
right,
air quality, etc. So it's that you have to proactively be working on this because there's too much exposure today.
right. Yeah, there's over 1,300 chemicals in skincare, cosmetic things
Yeah.
in the US that are banned in Europe. You can't
Yes.
buy a new couch and not have it, sprayed with,
Yeah.
14 different flame retardant chemicals that are going to leach right into the air space and onto your skin and be absorbed through your skin. Those are highly toxic things.
Yep.
We could go on and on and on. I just saw a whole article about bamboo clothing, thinking that that's so
Yeah.
good for you, but the amount of toxins that they use in creating, from a bamboo plant
Yeah.
to create it into a clothing product, it can be more toxic than anything. I mean, things you think you're doing that are healthy, you find out they're not healthy at all. So
Yeah.
it's like you got to stay up on information. And as painful as it is, you've got to be listening to people that are telling you the truth because you're not going to get it from the companies.
Yeah. It's funny you mentioned that bamboo thing because I literally shot a video about that this morning.
Did you really?
Yeah. Yeah. I think I may have seen the same article as you. So it's going to come out in the next few days. But yeah, there's these solvents that are being used to take that bamboo is a rough fiber. It's not, a soft, malleable clothing like fiber. So to get it into that form takes a lot of processing. And this is where you're also finding clothing chock full of forever chemicals, your PFAS chemicals, and it's kind of like the war story. How is it even possible? Like in these active wear pants that women are wearing so much of, you're very specifically finding the forever chemicals in the crotch lining,
Uh-huh.
which is you have this cavity with this highly absorbent skin, which is the worst place you could find it, right?
Right.
And for clothing that you wear while you're like sweating it at the gym. So, and you wonder like what's going on with all the cervical cancer and ovarian cancer. And like, yeah, you have constant exposure of forever chemicals. So it's just getting back to basics and the conveniences that we've bought into. I understand the value of that. We got to drop them and realize wool, linen, natural fibers. And if you want to get into the woo-woo territory, it's even the frequency of those fibers. We know that
Yeah.
we are frequency and the wool, linen, these cottons, their particles, live at a certain frequency, which is beneficial versus plastics, et cetera, that were not meant to be in our body.
Yeah, exactly.
Yeah.
It gets overwhelming for people. I do get that. And you made a comment there that it's really getting back to the basics.
Yeah.
I'm excited to see the homesteading movement going on where a lot of
Yeah.
people are trying to get back to some basic things. But I mean, you don't have to go to the point where you're going to live off grid and, grow everything yourself. I mean, getting back to basics just starts with some baby steps.
Yep. I guess, so from my perspective, we take a genetic view, which is there's so much overwhelm. The word you use, that's the truth, overwhelm. So if you can prioritize and know what to actually focus on and at least do that right. So take me as an example. There's a gene called GSTM1, which is a primary driver of glutathione activity in your gut. So your first line of defense to remove the toxins that come along with the food, the plastics, the packaging, everything that you don't want entering your bloodstream that may lead to gut dysbiosis, leaky gut, etc. I don't have that gene. So it's not even about what version, what variant. There's something called a copy number variation, which tells you not a SNP or a spelling error within the gene, but do you even have the gene or do you have extra copies of that gene? Right? Unique variant that only happens in certain genes. So I have this copy number variation, 0. So for me, the source of my inflammatory issues was my gut. Even though I was eating the same clean food, clean quote unquote, as my business partner, the subtle nuances of the packaging and the drying chemicals that are used to dry chickpeas to make hummus. I thought I was eating healthy food. I was eating hummus, but it's actually dried with chemicals to make it the yield turn around faster. So things like that I need to learn. And so that was my big priority. I actually do really well with inhalation airborne based toxins. When I was young, I ran a landscaping business when I was in school. I was fine, versus a couple of my friends that I hired to work with me that used to get headaches and not feel so good. Because I actually do really well with it. And not saying that I should be exposed, but I do well with it. So
Right. From
I
a
guess what I'm
genetic
saying is,
standpoint, you make enough glutathione in your lungs, you don't make it
yes,
in your gut.
exactly. And so now I know what to focus on and prioritize. And that really helps with the overwhelm. Here's my big rig, my leaky hole in my boat where the water's coming in from. Let me plug that first,
Yeah.
right?
So that makes an easy segue of getting into what you do and your whole genetic profiles that you look at. We do the same thing with our cancer patients. Genetics are important. I'm not saying genetics cause cancer, but genetics give you clues of why why you couldn't get rid of those toxins, or why different detox pathways that have issues, why your liver isn't functioning the way it should. So yeah, we need to get rid of exposure, but you can start where you're going to be where you're going to be primarily absorbing it or not being able to get rid of it.
Yeah, because that action plan is going to be comprehensive and overwhelming. And so what's the lowest hanging fruit for you?
Yeah.
Right? For some women, it's internal. It's not even an external source. It's not even like, hey, I need to cut things out. Yes, you do need to cut things out, but the primary concern may be the hormone that you make. Some women who are more, and you mentioned genetics and cancer, and a lot of people, the first place they go is like BRCA gene and APOE and dementia genes, and I know that you have this functional thinking, so you go far beyond that. But I was just literally prior to this call that we're having right now, I was on another call with a lady who was told that she has a certain version of the BRCA gene, and she called me to ask if she should get a mastectomy and and I think it was a removal of her fallopian tubes,
Oh
right?
God.
So she's heard the decision was, do I go chop a bunch of my body parts out? And my answer was, well, there's also a risk of liver cancer and brain cancer. You should cut those out too, right? She's like, what do you mean?
But that's the absurdity of it. I mean,
Yeah,
people who do that. I mean, she's asking that question because probably her oncologist has put her up to it.
yeah, exactly. So
It's just
here's this risk.
absolutely absurd.
It's absurd. And now, but no, so I asked her, did the oncologist that told you, and that's exactly what happened, that you have this BRCA gene, go cut your breasts off, tell you what the BRCA gene does?
Yeah.
She said, no. And like, so how do you know it causes cancer? She said, what? It's a risk factor. I said, well, risk for what? What does it do? So we talked about it. And this is the difference between genetics and functional genomics. Genetics is you have the BRCA gene, go cut your breasts off. Versus functional genomics, the BRCA gene is a tumor suppressor, fights cancer. It also repairs DNA damage and oxidation and a lot of other things that are going wrong. If you have not the BRCA gene, but a certain version, a variant, you don't do such a good job of repair. So God forbid you get cancer, you're not likely to fight it that well. You need additional support. So why did you get, we still haven't even looked at why did it happen. So the thing that I was saying about hormones, some women are more estrogen dominant, and we can determine this genetically. You can also determine it through Dutch testing and other methods. They make more estrogen than they need. They're estrogen dominant. They also, step 2 of 3, the metabolite that they convert it into. So when you have your monthly cycle, you make your hormones and then you convert them into 2-hydroxyestrogen, 4-hydroxyestrogen, 16-hydroxyestrogen. 2 is good, clean stuff until you're menopausal, and it also becomes problematic at that time. 4 and 16 are DNA damaging, like from birth at an early age, and continues and continues. That's the thing that if you make too much of it, may be the source of damaging cells to the point where something problematic like cancer could happen. But then why not every woman if it's so deterministic? Well, then there's a third layer. What are the detox pathways that eliminate that metabolite? There's your same glutathione pathways we talked about. There's your antioxidative pathways, so mitochondrial function. There's your COMT, which is a protein that removes and eliminates things. So how well is that working? And you can start to see the puzzle and this full picture of, oh, estrogen dominant, estrogen toxic, bad detox. I'm having a monthly cycle of inflammatory insult. And on top of that, I'm using a Teflon coated frying pan. And I'm on the birth control pill. And I'm wearing yoga pants with forever chemicals. So the epigenetic load on top of that genetic profile is equally a combination of too much total load. Now, fast forward, menopause, no more menstrual cycle, no more clearance and removal, and your body's trying to protect you. It's like, well, where do I put all this toxic nonsense that I make? I'm going to go store it in fat. I'm going to protect the organs.
Yeah.
And of course, women have fat in the breasts. And then you get this phenomenon of, 2 years into menopause, women on BHRT get breast cancer. I'm not saying BHRT is bad. I think it's great. I just think you have to be personalized. And that is like, that's the point where now you got to think about what version of BRCA do I have? Because
Yeah.
you actually have the cancer, right?
Right.
And you could have tested a 5-year-old girl and told her this story
Yeah.
and many
Yeah.
other stories. It's not just this one, right?
Right. Yeah, it's definitely more about prevention. And you talk about cancer, it's never, hormonal, even a hormonal cause. People think they're ER positive or PR positive cancer, that it's caused by the hormone. No, the hormone, that even that 4-hydroxy is just blocking the estrogen beta receptors. We're blocking
Yeah.
apoptosis. It's not the cause of the cancer.
Yeah.
Something had to get inside the cell and damage the DNA.
Yeah.
And most likely, the forever chemicals or the toxins that you're exposed to. So
Yeah.
looking at the, big picture, taking the baby steps and trying to clean up that person's environment, uh, getting some proper testing done. You mentioned getting hormone testing done. It's just crazy how many breast cancer patients that we have that their oncologists never tested their hormones, but we're going
Yeah.
to go on aromatase inhibitors for the next 10 years. It's like, never test the person's never, ever have I had a breast cancer patient where the oncologist even did a simple estrogen blood test, let alone doing a full Dutch
Yeah.
test. It's just sad, which tells you that, they're all just pharmaceutical shills that are just kicking out, revenue to follow a pattern that is listed in Merck manual that is written by the pharmaceutical industry.
Yeah.
It's sad. You got to take responsibility. So,
Yeah. Well, when you have a $4 trillion healthcare system, of which 90%, that's the actual number, 90% is spent on chronic disease. There are certain people I don't want that to go away. That's $3.6 trillion every year,
right,
right?
right,
And and at the top you have a $4 trillion food industry that's owned by the same people, and then you have a multi-trillion-dollar chemical industry. So there's a challenge for all of us, which is the economics of it all makes it very difficult for everything that we're saying to be real.
right.
And so you have to go back to the very first thing you said. You have to manage it yourself.
Yeah. Taking that personal responsibility is so, so
Yeah.
important.
Yeah.
Well, what's some last words of wisdom that you want to share with our listeners?
Well, I mean, for what I've learned, from the point that I was sick to the point where I'm at now, I went to this complete evolution of my thinking of victim, disease happened to me, why, right? Why me? To learning that I caused it and I don't need to have it. I'm sitting here in front of you without any of those things. And I truly had them all. And I thought I had them all. They were, part of my life.
Right,
So chronic disease is a choice. The way you age is a choice. Your energy, your libido, your hair, your skin, all of those considerations that we're all treating topically, it's all a choice. There's a lady who's a major influencer who's a private client of mine that's sort of on like a retainer. I maintain her health, right? And the other day she put out a video with no makeup for the first time. And I told her, I think you need some kidney support. And she's like, what are you talking about? And she just had these dark circles in her eyes. I've just never seen her without makeup. Right. And I think I said, you also need some liver support. Like you're yellow. Right. And she doesn't. So she said, I went to the doctor and I'm not sick. And I said, that's the whole point. You will be.
right,
And so these understanding that the ancient wisdom we had, which we're now thinking is alternative medicine, was medicine. What we now have is alternative. It's a different way to deal with the body, which is cause the illness and then mask it and manage it and actually maintain it to make sure the person stays in the disease state so that they're
right.
an eternal customer, right?
Was
And not only that, let's turn this one disease into 3 diseases, right? That's the line extension, product extension, right?
right,
Per person, versus we did have a healthcare system where chronic disease wasn't a big deal. Yes, there was viruses and war and injuries and acute problems, but chronic disease wasn't prevalent. It now is. We now have the wealthiest empire that's ever existed that's also the most sick.
yeah,
And
it's
it's unbelievable, right? And because the basis of our health is an economic question, not a health question. So it's a choice. You have to know what to prioritize, which means testing. whatever you're using, do something to know what's going on on the inside, right? Understand what the cues mean, your skin, your tongue, your eyes, your energy levels, your mind, what are all these things, your gut, and the last thing, sorry, you asked me for one sort of word of wisdom. I had many, but there's one last thing I would say is that having dealt with so many people that are kind of stuck, I haven't met anybody that is stuck that doesn't both have a gut issue and also is stuck in somewhat of a fight or flight state where their mind is preventing them from healing. Right? So understanding your executive function and how you're wired and why the same exact exposure for you is anxiety and stress versus somebody else where it's not. And the body doesn't heal in a fight or flight. It's just very binary. You're either recovering or you're fighting. And if you're stuck there, which is so easy to be because today there's so much stimulus to cause you to be stuck there, very tough to heal. So it's like fix the mind, calm down, fix the gut, and now let's start dealing on everything else and get yourself to a level where you can then maintain. And then maintenance is your job. There's no doctors that will do that. That's your job, right? So
Yeah.
that's kind of how I think people should address their bodies.
Well, I agree. Choice and responsibility. Choice,
Yeah.
responsibility, right?
Yes.
Well, thanks for being on. Let's not make it as long as we did last time. I'll have you on for the next few months.
Sure. No, it was a pleasure. It was good talking to you, man. I've been thinking about you too because there's many people I talk to that are stuck in these cancer journeys. I always remember the reverse, the interview I did of you and all the things that you said, which I repeat over and over again.
Well, thank you.
Yeah.
All right. Well, we'll talk again soon.
All right. Great. Thank you.
All right. Bye-bye.